Okay, so Miss Karen, I would just like to ask, my first question would be, what is your career in healthcare and how many years of experience do you have?
I my experience in healthcare is a combined of about 25 years. I work both at a level one trauma hospital as well as a lower level hospital or rural hospital in the surrounding counties here in Macon, Georgia, and Warner Robins. I also have experience with in office or office professionalism, where I was served as a sleep tech and a neuro tech as well. So if you tack on about 4 more years to that, that would probably be about close to about 29 years altogether if you add everything together.
So it's almost 3 decades of doing healthcare. Is that correct? And you have helped so many lives, I'm pretty sure. So my next question is, what do you currently do now, and what are the expertise needed to get to your job?
Okay. So right now I'm currently the Academic Success Center for a local technical community college where I oversee a team of tutors that is involved with both healthcare tutors as well as like basic skills like math,
Mhm,
English, reading, those types of skills for students,
mhm,
local students. Um, really, yes, healthcare experience really played a part in me getting this position,
mhm.
as well as my previous positions of being in customer service as a manager for several local food services. So that played a part as well
Okay,
in the position.
okay, thank you for that. So, Miss Karen, my next question is something that takes you back to your roots. So, I want to ask you, what made you pursue a career in healthcare? Because that's what you said in our previous mandatory meeting with Miss Chandria, that a career in healthcare is not actually something that pays you well. It's actually hard and it's actually taxing. So, what actually made you pursue this type of career?
Okay, so as a young person growing up in a small country town,
Mm-hmm,
I saw a lot of my family members that were getting home care. So that kind of started the feel or the fire for healthcare. My grandfather in particular, he used to always say, Karen, you need to be a nurse. You need to be a nurse. You need to be a nurse. I'm like, I don't want to be a nurse. I want to work. I actually wanted to be a pharmacologist and work with
mm-hmm,
medicine. So that was my passion. But seeing that I had to assist their person would come to the house because he had a amputee, a
mm-hmm,
leg it was amputated. So we would always just assist the CNA or the nurse that came to the house. So that kind of got it started. So of course, after I graduated, I moved here to the area, Macon, and got married. Still wanted to try to pursue this chemistry, computers thing or whatever, but it never worked.
mm-hmm,
So one day I actually applied. I was looking up schools here,
mm-hmm,
and one relative said, Karen, you ever thought about going to middle? Well, at the time it was Macon State College. It's now Middle Georgia State.
mm-hmm.
And I looked up a program. I was like, I said, respiratory therapy? I said, that's what I used to do to help the people for my granddad. So it went from there, and that started back in 1999 when I first started school there. And I started in 99, I graduated in 2004, so I've been in healthcare ever since.
Okay, so that is a very inspiring story. So it's really started with your granddad, made you pursue a career. So you and Miss Chandra are both RTs, am I correct? Respiratory
Yeah.
therapist. Okay, that is wonderful. Okay, next. So of course now we know the start of your career with healthcare. Now I want to ask, what keeps you pushing forward? Because like what you said, you have to be inspired. You have to find the passion in you to continue working in healthcare. So what is that passion in you? Your grandfather started the fire. So what keeps it burning?
The need, the need for better healthcare workers. I can tell you, students that come through the Academic Success Center, there is a lack of number one, ethics. Number two, there is a lack of, I don't, I guess you can think of it like an educational drive. Like they're not putting the connection as far as good healthcare versus bad healthcare habits. What is the purpose of you going into healthcare? Are you just in it for the money? And that's where I'm
Mm.
seeing. Okay, I'm just seeing more of the students just going in. Oh, I'm going to make money. Oh, I'm going into this to make money. That is not healthcare. Healthcare, care is the main thing. Care
That's
means compassion. You got to have compassion to see about your patients. It's not about the money. It's never been about the money with me. Because if that's the case, then I would be somewhere else.
right.
But because of that foundation and that fire started with my grandfather, and I saw the compassion and the care that was given to him, that's what it's about. It's about making sure that your patient is cared for, you
Mhm.
know. Making sure you're not just doing the minimum shortcuts just to get through your shift. But no, it's about the motivation in me knowing, hey, okay, if I can push you to be a better healthcare worker, then that's what I'm gonna do.
Mhm.
So that's
Oh.
what keeps me motivated. The lack of healthcare skills now that I'm seeing in the students. So I'm like, there is a need for me.
Mhm.
So
Actually, I also believe with you in that because nowadays, yes, the healthcare workers might be skilled, they know how to do things, but the problem is they just don't really care about that much about the patient because what they are after is the dollar bills that they'll get. They don't even think of it as a reward for doing something good. It's just I want the money straight out. So that is sometimes the problem of the healthcare workers nowadays. So now I want to ask you the question in relation to your answer. You are now in the education side of healthcare, correct? So
yeah.
how do you translate teaching care? Because care is something innate. It's something that comes from within. So how do you teach care to a person or the passion to care?
Okay, so what I do in my lab, I actually started out as a part-time healthcare tutor
Mhm.
um, before I got the current position as the coordinator. And when I first got the position, it was kind of weird because they never had a healthcare tutor, which kind of blew my mind because I'm like, okay, when I was in school, there were tutors for us. So I really built the tutoring at this local college. I've had nursing students look for me by name. Like they was like the teachers, they're impressed with me because of what I'm teaching them as far as the skills are concerned. But I'm also teaching them the um, the lecturing part or the clinical, not the clinical part, but the actual lecture part, making them understand what you're reading has to apply to your skills. Those are the type of teachers and instructors I had. If you can't apply what you're learning in the classroom to the skills that you're going to bring to
Mm.
the patient, then we have a problem. So what I do when students will come to my lab, my tutoring lab, I have computers in there. I mean, we can sit and we can do practice questions all day. But if you can't apply what you're learning from the textbook to your clinical skills and how it connects, then no, we're going to do this over and over and over again until you see the connection. So how I teach it is I draw pictures. Very simple. There's nothing special about it.
Mm-hmm.
The student draw pictures or we'll look at pictures. I say, okay, look at this picture and tell me if you're reading about this order, this disorder. So
Mm-hmm.
say we're studying the heart. Okay. We see a lot of patients now in the world in our hospitals that have heart problems, especially like hypertension, heart failure, different things like that. So what I do, I take the picture of the heart and I break the heart down. It's like, okay, if you have a valve problem, where's the valves in the heart? And you'll be amazed how many students they cannot label a heart, which concerns me. And I'm like, okay, let's go back to the beginning. Tell me the flow of blood through the heart. And once I do that, and they're like, "Oh my God, are you serious? Is that simple?" I was like, "Yes, it's all about anatomy. It's about knowing the structure and the function of each part before you can understand the disorder." And it's all about me teaching them the basic foundations first to apply the disorder and where's the problem. It's about where's the problem and what do you do to treat it. So that is how I make my connection, and I teach these students those skills by going back to foundation one. And
Okay,
that's
so
what it's.
okay, so to basically sum up your answer, it's about teaching the foundations back again, going back again to the roots. It's all about the foundations. That is the basic need for the healthcare workers nowadays. Is that correct? Okay.
Yes.
So now that you've mentioned you are now in the education system, and I would say that you are a mom as well. Am I correct? Do you have kids, Miss Karen? How many kids do you have?
I have 4 girls and I have 2 grandsons.
Okay, so you have grandkids already. So, okay, now my next question is, as a teacher, someone who works in healthcare, a grandmom, and a wife and a mother as well, how do you balance all the time in the world? Because there's only 24 hours. And by the way, Happy New Year's as well. How do you balance this time in the world? There's only 24 hours, and how do you do it?
Oh my goodness. Okay, so my day starts at 6 o'clock in the morning. I get up, I take my youngest daughter to school. Um, and I basically have a set schedule where take her to school, go to work. I find time in between to contact my husband, say, hey, just checking on you. Um, of course, I take care of my students. I take care of my administrative duties with my boss. Um, Go at the end of my day, I go home. I actually go and pick up my daughter, um, pick her up from practice or whatever she have. I come home and I also tutor online and I teach online once I get off of work. And I still find time to cook. I cook for my husband, my kids. I spend time with my grandkids. Even if it's just 5 or 10 minutes, and they understand like grandma's busy or mommy's busy. This is mommy's schedule. But I do manage it just by having a consistent schedule. Like now we're on the break and I spend a lot more time as long as I'm not working. But when in the bustle of things or when I'm busy, yeah, it's just all about having a set schedule. Making sure you schedule it out, making sure everything's kind of accounted for by hour or by hours, but that's about it. I mean, it's God's grace, number one. I thank God that He gave me the ability to do that because most people couldn't do it. They can't do it,
Mhm.
but I do.
That is correct, and I applaud you on that. Very congratulations on being able to manage many tasks on different things. And I think that is a skill that you have acquired from being in healthcare because i- doing healthcare
Mhm.
jobs, you need a lot of time management because as you said, you have to do everything in hours because once you miss the hour, you might have delayed the transfusion, the medicine, the processes. So that is something that we do want to avoid in healthcare. Okay, so next question. Miss Karen, of course, there are highs and lows in the job of healthcare, correct? So, what do you consider to be your highest moment in healthcare, and which do you cherish the most?
Oh, my highest moment, believe it or not, Glenn, is when you see the patient go home. Um, Especially if you as a healthcare worker have done everything you're supposed to do to the utmost ability. When you see that patient go home, oh my God, it is so rewarding. And when that patient comes back and they see you in a store and they remember your face, you may not remember them, but sometimes you will. And they come up to you, they're like, oh my God, you took care of me in the hospital. I'm like, which floor were you on? I would have to kind of backtrack it, but eventually I would figure out who it was, or even if a family member, even when we have a demise of a patient, but those family members remember those special healthcare worker that took the time to show compassion, even in that process of their family member dying. They remember those healthcare workers, especially in the palliative care.
Mhm.
I still remember to this day, it was this one family who we did everything we could for this family. And when the patient himself came, he looked up at me and he was like, thank you. Thank you for being here. You never left my side. Even the family members were like, you stayed with our dad to the end. I mean, they literally did not want me to go. Like when we moved him and we removed the tube, and he, after I took the tube out and he talked to me, he was like, thank you. Even in that moment, that was the highest point because it was the care that I gave. And that's where a lot of the healthcare workers now are lacking. They're not making a connection with the patient. They're not making a connection with the families. And that's where healthcare is really disappointing to me nowadays because we don't have those people anymore, you know? Even with the experience with my own father last year, I saw the lack of skill and the lack of ethics and the lack of compassion in the healthcare workers because they didn't care. And if I had not have been in the place I was with my own father, things would have went worse than what it did.
Hmm. Okay.
So those are my highest points in healthcare.
Hmm. Okay. So now that you've mentioned having to release a patient, seeing them go, even if they are at the end of their lives, them saying thank you to you, it really fills the heart. I think that is what most people in healthcare, those who give compassion, that's what most of them feel whenever they do send out their patients. So the next question is, what would be your lowest point? And how did you overcome it?
Whew, my lowest point actually was the unknown, not knowing what you're going to walk into each day. That is the lowest point of healthcare for any healthcare worker because you thinking, okay, your day is going to be fine. You got the same patients, your patients are doing good, but you can walk in and you be like, what the ham sandwich? What is going on here? Everything can go wrong. Everything can just change at the drop of a dime. And that is the lowest point for me because you don't know what you're going to walk into every day. So you have to really have the mindset of, um, okay, how do I prepare for this situation? You have to be on your P's and Q's every day. You can't let your guard down, especially if you weren't in critical care, because I was a critical care worker. So that's why I say the lowest point for me in healthcare would always be the unknown of every day walking into work. Even now in education, I still have to have the same mindset. I don't know what I'm going to walk into every day. Some students, they come in, they get it, and some students, they don't get it. You have to kind of coach them and say, well, let's think about let's see, have you thought about this career? Because you don't want your students to feel bad because they can't get it. But sometimes if they want to go in healthcare, we can probably find another avenue in healthcare for them,
Mhm.
but not necessarily nursing or direct patient care. There are other avenues like medical assistant, medical receptionist, things like that.
Mhm.
So again, my lowest point, even in healthcare in the hospital, was the unknown, and that still applies today. What is the unknown I'm going to walk into, which is my low point.
Mhm. Okay. So would you say that not knowing what's gonna happen on the next day or the future is the biggest negative of healthcare jobs? Would you say that that's the hardest part of it?
The
Mhm.
hardest part, yes,
Okay. So
that is the
uh, okay, so to add on that, because I have also been in the healthcare since I've started working with Miss Chandria, I have a fair share of clients. I'm talking to clients as well, and even on the phone, sometimes they are harsh because most of the clients that we have on healthcare they are old and they might be grumpy. So of course, this is one of the things that my generation would really have problems on. How do you deal with these harsh clients? Because I think that is where the bridge is broken right now. We don't get to see eye to eye with the elder generations. That's why the compassion does not cross the bridge. So how do we deal with the harsh clients, and how do we make sure that they know what they need to receive, and how do we explain to them nicely?
so from my experience, when you're dealing with those ornery older people, you have to just be a listening ear. Um, I've learned that once you show respect as far as listening first, it kind of smooth things over. Sometimes most of the time it works. Sometimes they just want to be like, is there anything else, is there anything you want to talk about? Is anything bothering you? How's your family life? How's your home life? Sometimes they just need a listening ear. And if you show that you're willing to listen at them, and sometimes you just have to let them vent first. I found that a lot too, that they're set in their ways. You can't change that, but you can just have a little bit of compassion and respect, and just say, "Hey, look, um, I'm just here to help. If you feel as if I'm crossing the line, just let me know." I said, "But I really want to help you get to the next phase of either going home or getting better. Is it something that you want to share? That maybe you're having a problem with?" It's about being an active listener for the elderly, and just being humble and patient, of course. But sometimes that works. But again, a majority of the time, it's about a listening ear, active listening to their problems, how they're feeling. If they feel neglected, a lot of times it's a lot of neglect at home that leads to that grumpy, like, oh, you're not going to take care of me. You're just like everybody else.
Mm.
So getting to know the person and just having a conversation first, have an open conversation. You'd be amazed at what that does.
Mm.
It changes.
That, that is correct. So, to interrelation with your answer, I actually know a bit of experience with other people in healthcare because I do have family members who are caregivers and nurses. So they do tell me that a conversation really does a lot because most of the healthcare workers nowadays, they just go in, do their job, go out. They don't even try to strike a relationship, and they know that they're going to be spending a bit of a time with the person that they are taking care of, but they just don't talk to them. It's like they are a they're not even they're just an object on the side that needs to be entertained, that needs to be changed every now and then, needs to be taken a bath of, but they don't treat them as a person. I think that's the problem. So as what you said, a small conversation would go a lot. It's a really long way. Okay, so with relation to that, I know that times are changing. Um, People are now trying to look for other works, look for other avenues. So how do you inspire other people to continue working in healthcare?
Whew, that's a tough one right there because it depends on the person. And what I do, if a student comes to me and they're like, I don't know what I want to do, and I just kind of quiz them. I was like, well, what is it you like to do? Do you like to work with your hands? Do you like to communicate, talk to people? What is it you like to do? And they said, oh, I just want to help people. So that right there, when they say you want to help people, I stop them. I'd be like, okay, what do you mean by help people? Do you mean help them as far as health wise helping them? Do you want to help them get better or feel better? Or is it that you want to provide other type of help avenues, like maybe like coaching or assisting them with like financial reasons or anything like that? Because you can help in different ways. And most of the time it's normally healthcare, but once I grill them or I say, hey, okay, if you want to go into nursing, okay, and I hate to say it, but you're gonna have to wipe poop. I just be upfront with them. I said you're gonna have to help them get dressed. You're gonna have to help them brush their teeth, and things like that. I just start with the basics, from a CNA level, you know, and they're like, "What do you mean I gotta help them? Can they go to the bathroom by themselves?" I said, "Well, sometimes you're gonna have patients that can't go to the bathroom by themselves. So, are you willing to do that?" And most of the time they'll be like, you know what? No, can't do it. I said, well, okay, let's try another avenue. Do you like to draw blood? You can be a phlebotomist. You'll be amazed. Oh yeah, I can stick somebody, I can draw blood. That doesn't bother me. So it's about finding the avenue that fits the student. Once you find that avenue, then you can excel with that student and probably push them into the next phase of healthcare. So that's what I find myself doing a lot. Like one student, two students, actually, they were older students. They always wanted to be a nurse. So they couldn't get into the LPN program. So I said, well, let's backtrack. Let's start with CNA. Get your foot in the door. Learn the ins and outs and basics of nursing. So now that they've done that, now they're going on this semester. They're going to start after a year of working. They're going to start the LPN program. So it's sometimes you have to just help the student backtrack just one step just to get them to where they want to go. So
Right.
that's how I motivate students to stay in healthcare.
Wow. Okay. So it's really about just going back to the basics. That's really your main thing. Because again, once you do get the handle of the basics, you would be able to do the more complicated things moving forward, correct?
Right.
Okay, good. So, what is your future message to the future caregivers? Any parting message to the subscribers, to those who want, I'm gonna post this on our page as well because this is a very good interview and I think that they should be able to watch this. So, what are your message to them? Any future messages? How do you inspire them? And that's it.
Okay. My message for any future healthcare worker is make sure you have a heart for it. Do not go in it for the money. This could be your family member. So always put yourself in that patient's position. Would I want myself to take care of me? Think about what you're doing now in your healthcare job. Would you satisfy yourself? Would you grade yourself? Are you able to, would you want yourself to hire yourself, basically? Grade your own self. If there are areas to improve them. If you want more out of your career, then begin to build a plan. Always have a plan. Never stay where you are. I always encourage students. They can start out as an LPN. Okay, let's get this down. Go to RN next. It's nothing wrong with taking steps. And if people who give advice for healthcare workers or healthcare, students that want to go in healthcare, don't listen to them and say, oh, you know what? Don't worry about starting here. Just go right to the RN. No, that's not true. It's nothing wrong with starting with the basics and building yourself up to where you want your ultimate goal to be. And that's where I am. I have one more degree to go to become a doctor. So soon I will be starting. I am going to be a doctor soon. So if I can do my steps one step at a time to get to where I'm going, I suggest that for all healthcare workers. Make a plan, make your steps to be successful.
Okay, thank you very much, Miss Karen, for that wonderful message. And I also want to thank you for this very wonderful interview. I was actually expecting so much and I got so much more because of your answers. Thank you very much, Miss Karen. And are any things you would like to say to Miss Chandria or anyone else?
Miss Chandria, you keep up the good work. I am so proud of her. Like I said, we've been knowing each other for years, and it was a blessing that she found me again and kind of helped me get my business started, where I provide healthcare education, tutoring. So she's really a jewel, and anyone that works for her, you guys are in a blessed place. You are in a blessed place, and trust me, she will help you get started on your own avenue in healthcare. She's willing to do it. So please, if you're working for her, please just trust her, trust the process, and you will have a blessing and favor will follow you. I promise you, favor will follow. Mhm.
Okay, thank you very much, Miss Karen. And that would be it for the